Bob Saget, the beloved star of the sitcom Full House, died of a head injury last month after an appearance here in Ponte Vedra Beach. His family releasing those details yesterday, saying he accidentally hit his head and drugs and alcohol were not a factor. While tragic, according to health officials, the circumstances surrounding his death are not uncommon. According to the CDC, approximately 166 Americans die from traumatic brain injury-related events every single day. Dr. Stephen Scibelli, a neurologist with Memorial Hospital, joins us this morning to talk more about this. Good morning. Certainly a story that has stuck with us here because Bob Saget's last performance was in the Jacksonville area.
Well, thank you for having me, Vic. Yeah, it's certainly a sad situation, and we send out our condolences to his family, friends, and obviously his millions and millions of fans.
So, Doctor, for about a month, we didn't know the details of his death. Now his family is opening up about it. They say that the actor accidentally hit the back of his head on something, thought nothing of it, and went to sleep. How often do you see injuries like that that can be life-threatening and, in this case, deadly?
Well, certainly I work at Memorial Hospital in Jacksonville, Florida, so we're a trauma center. We see an immense amount of head trauma. We see patients that have similar stories where they thought it was a minor injury and then present to us in extreme condition and need immediate intervention at times. Most of the time, such injuries don't require surgical intervention, but there are many types of traumatic brain injuries that can happen from a fall or a blow to the head that initially may seem less critical than your medical professional may realize.
Look, I think we've all hit our head, or we've had a loved one that has taken a fall and had some sort of head injury. What do you need to look for to say, hey, this is not something that we can just ice. This is not something we can sleep off. Let's go to the hospital and get this looked at professionally.
Certainly, anytime you've had a significant blow to your head, I'd rather you get evaluated by a medical professional. But if you see signs of it, such as disorientation, the person may have kind of a blank stare or seem as if they're just not sure where they are. They may not know the names of the people around them. They may just seem a little dazed or confused. You may, in a more significant injury or an injury that's presenting very early, you may see a weakness in an extremity. You could see a facial droop where part of their eye or mouth was sagging. You could see their tongue deviate. Think of it as you've heard a lot about sports patients having concussions and such. So a concussion is a minor form of a traumatic brain injury, and there's several grades to it, really 3 primary grades. But there are many other injuries that can happen, and some of those have what we call a lucid interval, where the person has an injury to their head and they seem perfectly fine for a period of time, and then they can have a sudden deterioration.
Dr. Stephen Scibelli with Memorial, thank you so much for your time this morning. I think the moral of this story is, if in doubt, get it checked out, go to the hospital, and have the doctors evaluate you. Appreciate your time this morning.